Okay. All right. Thank you, everyone. Thank you so much for joining us today and for being patient with us as we get this coordinated and started today. Welcome to the second part of our kickoff for the Collaborative STEAM Solutions for Arizona's Health Challenges Fellowship. We're going to today go over a project overview a little bit. We did talk about that more some last week, but we're also going to do a deeper dive today into the nitty-gritty of that fellowship. We have an agenda. I've put the link to the agenda in the chat. I'm going to drop it in one more time for those of you that just joined us. And the agenda is also linked on the calendar invite. And so we're going to start off today with about 15 minutes about the fellowship, and then we're going to hear from Dr. Sonia Vega Lopez with Larry talking about health inequities. And then we're going to go back to the fellowship a little bit more, some more information about the fellowship. And then we ideally will be able to end today with about 20 minutes with folks in breakout rooms where the teams can start to work together. And so that's our goal for today. So very quick reminder of the goals for this project. The first one is to create awareness of health inequities in the local Arizona community and to generate openly licensed student assignments that engage STEAM students in recognizing and addressing health inequities in their local communities. So just kind of keep those big goals in mind. We have a very high level timeline here. This is the second of our kickoff meetings. And next week really starts off our webinars. And we are running webinars on average every 2 weeks between February 7th and April 18th. The faculty and student partners co-create those STEAM assignments really beginning after today's webinar or maybe during today's webinar. And we are recommending that those teams meet twice a month. And we are providing library consultants as well as they're part of the project facilitators to help as needed. And we're going to talk about those optional drop-in sessions that are available, and we're going to talk today about those reflections. And then your final assignments are due May 2nd, although always welcome to turn them in early. So we do have a website that we are really using as a way to centralize all of the information and resources for this project. And so maybe Stephanie or one of the others, if you could drop the link to that website in the chat. We're going to talk a little bit about the website today and kind of go through and show you some of the website and show you how to find things on there. But this website is where you'll identify, project information about the webinars. Each of those webinars, I will send a calendar invite for you for each of those webinars. But if you want to know more about the webinar, right, not just like, oh, there's a webinar on February 7th, then you would go into the website to learn about the speaker, their bio, the content of the focus of the webinar, things like that. This is where we'll put additional information about your assignment design process, as well as open education, evidence-based practices, all of the things. So please grab the link to that website. Oh, Stephanie, that's the edit link. They need the publish link, sorry. And so grab that and bookmark that, because we really hope that that serves as a strong resource for all of you. So excuse me, I mentioned the assignment worksheet. So this is really where we envision the bulk of your work to happen over this semester. Each team has a Google folder and an assignment worksheet. Okay, use that worksheet. It's a Google sheet to do the work of creating the assignment. It's all your brainstorming, your notes, your drafting, your editing, your finalizing. All of that work should happen within the worksheet. This is a Google Doc. It is a collaborative document. So both team members, all the team members can have access to edit that document. This is also the document where that the facilitators, the librarians can also have access to as we help you with your assignment. You have that Google folder that contains the worksheet because we think that you may also want to build, and you might want to provide links to articles, or maybe you're building a table that goes alongside the assignment or something along those lines, which is why we've given you an entire folder to work within. But that assignment worksheet is really where you're doing the drafting and the crafting of the assignment itself. And so this is what the worksheet looks like, okay? It is, as I said, it's a Google Doc. Down the left-hand side, if you're unfamiliar with Google Docs, if you pop open the outline on the left-hand side, you can very quickly navigate to different parts of the worksheet, right? So you can say, section 1, all the introduction information, section 2, all the information about the conceptual framework, because we're asking that you apply that conceptual, that 3x3 framework that Punya spoke about last week, right? All of the details of the assignment, all of those things will go in here. And I highly recommend that rather than scrolling back and forth through the document, trying to find a place, that you go ahead and you use the outline feature to the left. And then you'll see that there's a row for each item, right? So you've got a row for the title and a row for the author's names and things like that. When you have completed the assignment, after you've gone through the whole writing process, right? The whole creative process, all of those things, and you are done and final and you have no more edits to make, then the faculty is asked to copy and paste the information out of this worksheet into a Google form, okay? So the final version will go into the Google form, and all of the work leading up to that final version happens in this worksheet. The worksheet is created using a pageless feature in Google, which means that you can move the columns on those tables to make them as wide as you need to make them without it interfering with the margins on a document. So the activity at the end of today really asks that you go in and you find your worksheet and that you start to explore it so that you can come back and ask questions about how to use that. But know that these worksheets are really where your work takes place through this semester. So step 1, the worksheet. Step 2, the faculty will submit into that Google form. All of those rows in the worksheet are set up to mirror the Google form. So it'll be a straight copy from one row into a field in the Google form. So you can move stuff around in the worksheet, but it's going to make that copy and paste more complicated. Once that happens, once you've entered the final version into the form, doing that will generate a version of your assignment that we will use to build an anthology of assignments. Okay, so going back to our goals, right, to create a collection of assignments, we're building that collection of assignments using Maricopa Open Digital Press. The facilitators are going to handle that work. You don't have to learn how to use that platform. And we're building this book of assignments that we can then share out. And we will be happy to share more about steps 2 and 3. You're going to hear more about those as we go through. But know that your role from now until you submit, until you have a final assignment written, is all happening in that worksheet. Okay, any quick questions about any of that? Okay. All right. At this time, I'm going to ask Callie and Janelle to talk a little bit about evidence-based practices.
Okay. So Debbie, I very, very, very quickly made a few slides so that we've got some text references if you want to advance by one.
Sure.
So hello, everybody. So Janelle and I are your librarian consultants for this project, and we've got essentially 3 different roles that we're going to be using and fulfilling within this project. And the one that I really love and is close to my heart is talking about evidence-based practice and in the context of information literacy. So evidence-based practice is something that arose especially out of nursing, and health and care in general, that is examining how we provide research evidence for the reasons that we do things instead of just going by, well, this is the way it's always been done, or this is the common knowledge. That common knowledge should likely, especially in healthcare, be backed up by evidence to prove that this is something that works. And so looking at that in terms of any sort of health equity, it's still important to examine, where does this information come from? Are we making assumptions about the populations that it affects? And how can we apply this with sensitivity to different populations? Because you don't want to apply the same exact features and the same exact solutions that may not work for every population and in every context. So the idea of evidence-based practice is that you both assess using evidence, but also make sure you are asking questions that relate directly to the population that you are working with. So, all right, give me another slide. So we're using this, oh, there should be an image there that's not showing. Oh well. We're using this in the context of information literacy. Information literacy is a concept that's defined by the Association for College Librarians, college and university librarians. There should be a thing telling me what it is on the bottom, because I can never remember what ACRL stands for without taking a look at it. But it's
College and Research Librarians.
Thank you very much. It's a set of integrated abilities encompassing reflective discovery of information, and it's really examining all of the different ways that we use and understand how we apply information. So how do we locate that information? How do we use the tools, especially digital tools, and physical tools, to navigate that information? How do we synthesize it? And then how do we use it ethically, including citations, including research methods and bias, and all of those other elements that go into it. So when you're considering how you want to incorporate evidence into your project, information literacy is this wide umbrella that we're usually working under to make sure that we are applying all of the concepts that we need. So when you're working with us on a project, if you would like to use librarians as a resource, we are really happy to help you with basic OER and finding things and sourcing and explaining Creative Commons, but we're also really, really excited to go deeper into this and help you with developing different research methods, different ways of expanding out your project so that students get more research experience. Okay, next slide.
Callie,
Yes.
I'm afraid that when I downloaded and this file, I didn't capture the next slide.
Okay, then we will just summarize and I'll read off the one. There is, that would explain why my image is
Yes,
missing
I'm
too.
sorry. It is my fault.
Janelle, do you want to take this one or shall I keep going?
I'm not sure what I lost, like, is the slide deck that's in here also the same?
Yeah, I did. I dropped
Okay.
a link to the slide deck to the Google
Yeah.
Slides.
Okay.
So
The Google Slides should be updated. The downloaded version will not be.
they are.
Got it.
It's the
Yes.
downloaded version that's not.
So yes, I can address this, and if you notice in the slide, there's a slide deck in the chat if you want to open it up and follow along. But it talks about here as librarians how we can help you. So we can fill you in on a little bit more about what these open source education materials are, like the importance and the background of OER, and some of the frameworks for using that and how to apply it. And all the different tools that are there. So and also if you look at the AHESE website that we have, which was one of the other links in the chat from Stephanie, I believe, the one that includes Phoenix College in it. You can, if you click on resources from there, there's where a number of the things are that the librarians have expertise in to help you with. So we can take it a little bit further, we can explain things, and we can help you find some of those things. We have added to some of the pages and also from the website in under contact at the very top right on the website, it says contact, and that's where you can find little pictures of us and our information. And right at the very bottom underneath the librarians is a little blue box that says request librarian consultation. And you can use that to reach out to Kali or myself to either you might have a simple question and we could email you, but we have a form there that you can kind of fill out to help us get started so that we don't waste your time when we do connect with you, and we can go further with that to help you.
Janelle and Callie, we have a couple of minutes before Dr. Vega Lopez's talk. I'm going to stop sharing the slides and share the website, and then I can click through.
All right.
That. Okay.
I'm waiting to see there.
Okay.
There we go.
So
if you want to go up to where the resources are on the website.
If you click just resources, I got fancy and embedded the form.
Oh, you did. Look at that.
Too.
Okay. So yeah, that I hadn't seen that part yet. So that will really help you as far as help us help you to get to what you need. And some of it is stuff you can read through there, and it might be what you need. But we are here to support you and take away some of that frustration, because this is what we do all day long.
For this form, you'll notice there's a pop out right here on the form. You can just click that button and it'll pop out and you can complete the form.
Mm-hmm. Yeah, some of the places it's just a blue button that you click on to get the form to come up. But here you can actually see the form.
Were there?
But yeah, we want to work with the U.S. partners, and so when you do contact us, make sure to include all the emails, and then we'll get back to you on that.
Was there another page here that you wanted to share?
The reading and source list might be a good one to examine quickly.
Okay, sure.
So the reading and source list arose after we had such a great discussion in the chat last meeting. And so some of the health equity resources that we found and discussed due to one of the questions that came up in the chat. I've added them here. I've also added the speaker resources here. They're also under Allison Cook-Sather's bio, but I wanted to start collecting everything on one page. So if you're looking for a specific thing, you've got a one-stop shop for any sort of resources that are mentioned during these webinars or that we find that might be helpful for you. So if there's any further things that come up today, I will add them as well. If there's anything you'd like to have added on here, I'm happy to add additional things as well. This is really meant as a bibliography, essentially, of all the different resources that you might want to refer to and use during this process.
Awesome. Okay, there's also a page here for open education resources. Is that a good one to share,
Yeah.
Kelly? Yeah, okay.
So this page is a quick rundown. I may add more to it as I find more for both OER media and OER search and meta search engines. So there's different places to find images, and I'm happy to walk through any of how to use these places because sometimes they're a little bit funky, but there's quite a few different places that you can use to locate images and texts. And then we also have full search and meta search. Search engines will search just one set of OER materials. A meta search engine searches multiple different libraries of OER materials, so sometimes it's a little faster to find a huge list of things. Sometimes you get more things that you don't really want. So there's benefits and detractions from both, but that's both of them are really valuable things to start your exploration of what OER resources might be out there.
Awesome, thank you. Okay, so I'm gonna go ahead and stop sharing the website right now. And we'll go back over here and I'm gonna move, we'll start transitioning over to our speaker today. So I'm gonna move, let's see.
Debbie, maybe as you're doing that, I could start with a little preliminary before we get to Sonia. Just some reflection on last week and
Sure.
maybe where we're headed. Is that okay?
Absolutely.
Okay, so if you remember, we talked about this kickoff program and then this series of webinars to follow. I just want to frame that a little bit and also mention that Debbie will be posting very shortly the video from last week. So if you happen to not have been able to make it to Punya and to Allison's talk, you can go back and review those. Those two talks, Punya spoke about the conceptual framework and Allison spoke about the faculty-student partnerships. We said we're sort of devoid of content, so to speak, in terms they're not discipline specific. They're very general, very broad, but they're there for a reason. The conceptual framework we're using as a way to get you to think about the various domains of knowledge that you'll be dealing with, whether it's meta knowledge, procedural knowledge. I always forget the last one. There's three that when you talked about. It's in the video. And Allison talked about some ways to go about doing the student faculty partnerships, what works in those relationships and what can become barriers to a successful program. So I'd really encourage you, once you get that link, spend the time. We just had great fun and they were so knowledgeable. From here on in, the design of the webinars is really to seed ideas to you, to the teams, to the faculty student teams. And by seeding ideas, I mean, we're going to cover a variety of different disciplines in hopes that as you listen to these content experts today, you'll hear or experience the idea of, oh, that's in my domain. I could do a project in that area. We'll be talking, for example, with two individuals about the use of technologies in identifying inequities in communities. How does that manifest itself? Mining and impact on indigenous populations and so forth. So Today's talk, I have to tell you, with Dr. Sonia Vega Lopez, I'll formally do your introduction, Sonia, is a professor of nutrition in the College of Health Solutions at Arizona State University. She's a bilingual and bicultural researcher, a native of Mexico, and her research focuses on examining lifestyle factors, particularly those of diet and physical activity, and how to modify those factors for the prevention of chronic diseases, in particular in Hispanic populations, but I'm sure that they would generalize to a larger group. When I spoke with Sonia a couple of weeks ago, I shared with her an observation that this topic is one of, I think, the richest, if you will, for exploration. There's so much you can do in this domain. Because it impacts two things that we all have to deal with: diet and wellness, including physical health. So our conversation today with Sonia is going to be about exploring those two factors, how they play out in Hispanic culture in particular, but also bringing to mind places that we might think of for applications to this project. So we're going to be talking a bit about, community environmental health dimensions of access to food, for example. We'll be talking about cultural dimensions of how food is used and perceived within these cultures. So be thinking very broadly about how you might find a nugget in there that you can kind of go with in terms of your project. Remember, this is a STEAM project. So you're able to pull in the humanities and the arts and keep it, very, very broad, if you will, before you focus down. Then our next conversation on February 7th goes a little bit deeper into the impact of mining with Dr. Jani Ingram. Again, the idea being studying a domain, a discipline, to kind of get you focused and be thinking about, is that something that would align with your particular content area? Okay, enough of me. Sonia, welcome. And I have to tell you, folks, first of all, she's been very patient with me as we've gone back and wrestled around the questions, not wrestling so much about what to do or what not to do. It's just we have a lot. And because this topic is so interesting, can you tell us a little bit about your research area? How did you come to this, to study and focus on this particular area?
Yes, well, first of all, thank you for having me as part of this project. It's an honor to be part of it, and it's super exciting to hear that you're talking about all these topics that affect health of all of our communities. My undergraduate degree was in food science, so I learned all about, all the different ingredients and techniques that we have to produce foods, and it was more from the point of view of industry and not so much from the point of view of health. But definitely what we eat is affecting our health, and that was a stronger interest for me. So that's where I decided to pursue graduate education and was formally trained in nutrition research. My original focus was looking at nutritional factors that contribute to heart disease risk. And I was working basically in a lab setting, designing very controlled interventions, looking at what happens if people consume fiber A versus fiber B. Does that help lower your cholesterol? What happens with people who already have heart disease or have had a heart attack? So I was looking at nutrition from the point of view of disease already. And a little bit down the line, after I had completed my doctoral degree, I started changing my paradigm to looking more on the positive flip side and thinking at ways to promote health, particularly to prevent getting to those states in which you have to think about, how do I fix something that is broken? So thinking more about how do we prevent for people to have to get to those stages of having to limit what they are able to do or what they are able to consume, and more about health promoting mindsets. And this is especially important for people from disadvantaged backgrounds. And I had the honor of working with a lead researcher in Hispanic health, promoting dietary practices in people from the Hispanic population in a city that's high in Hispanic communities, and also of high and low income population. And that's what opened my eyes to look at the importance of all the social and socioeconomic factors in health, because you can make all the recommendations you want or know that are important, but in the end, you know, what people can do to really adopt those recommendations goes way beyond knowing what to do or knowing what to eat. And there are tons of barriers for people, especially those who are in more disadvantaged conditions, to be able to really care for their health. So I shifted more towards integrating social sciences to my work. And that's where I'm interested in looking particularly at what are the factors that contribute to chronic disease risk. And here I'm thinking broadly about, the groups that are at high risk for having obesity, developing heart disease, developing diabetes, and other chronic conditions that are associated with metabolism, that are more prevalent in those communities and populations. So because of my own background, my own cultural background, work more closely with the Hispanic or Latino population. But a lot of what I do is very relevant to other groups, Blacks and African Americans, indigenous communities, people in rural areas, people with low income. So I'm going to speak specifically about my work with Hispanics today, but really it's about promotion of healthy lifestyles for preventing those chronic conditions. And you started talking a little bit about the culture. For me, it's very important to do it in a very culturally responsive manner, because that's what will resonate more with people, and that will allow people to really, feel like we're not necessarily imposing restrictions on them and telling them what to do, but more that they can really bring up the richness of their culture in their lifestyle. So, long answer.
No, that's I've got a ton of questions, but I'm going to narrow it down to one on this point. If you look historically at the populations you've been studying, was there a time where things shifted? In other words, I don't know, I'll just pick a number, like 100 years ago, were the diets healthier in the sense of lifestyle and chronic diseases? And was there a point that something changed that impacted that, or has it been fairly consistent?
And now I think, the more industrialized our lives have become, the more we've had resorted to the technology that allows to make foods more processed and produced in mass quantities. So I think, perhaps, I don't know, in the 40s and 50s, there was this revolution of industrializing the food supply and having more products that were easier to make and fast to prepare. And we were resorting less and less to things that were produced from scratch, or people growing their own produce and having their own, I don't know, animals in the backyard and using those for their own consumption. So I think industrialization of the food supply has contributed quite a bit to health effects that we've seen with changes in diet and eating more processed foods, greater amounts of sugar and processed and refined sources of carbohydrates and so on. And that, coupled with the fact that now, we're less physically active because we're doing more
Sure.
sedentary jobs. So it is complex, but I think it's part of the industrialization and how technology has moved us.
And that phenomena, we'll call it, that impacts every ethnic background and population, right? I mean, things are easier access. I could run by, McDonald's and pick up dinner, or I'm feeding the kids from, Wendy's or wherever, because it's convenient, it's fast. I don't know about economical. It's usually not too economical, but it solves at least two of those three problems. So that's really so we've maybe the cultural traditions of diet and food preparation are reserved more for special occasions, right? Where we might make something from scratch that ultimately may be healthier for us than the day-to-day quick grab, eat something, as you mentioned, the processed foods and all. One of the things as you're describing this, it's coming to my mind is that there's this cultural aspect of access to food and the physical activity dimension, but there's also sort of the setting we live in. The You and I had talked earlier about access to places where I can exercise or I can go for walks or have green spaces and so forth. Have you looked at that or thought about how that impacts the draw on people to participate? I'm going to guess if I don't have that green space, I'm less apt to go out and find it, right?
Yeah, absolutely. And sadly, one of the factors that has been suggested as being an important determinant of health is your zip code. Where you live
Oh,
can really determine or can be a suggestion of what your health outcomes are going to be. And it has nothing to, or not so much the zip code itself, but really the surrounding within your physical location that can um, determine whether there's access to healthy foods, as you were mentioning, or access to fast food restaurants, more than other types of food outlets. Um, for physical activity, the physical environment around your neighborhood? Is it what we call a walkable neighborhood? Is it appealing for you to go out and walk? Here in Arizona, super important. Does it have shading? Does it have trees? So can you really go out on a walk when it's sunny, 95% of the time? Um, is it safe? Is it a safe neighborhood? Can you go out on a walk and feel like traffic is not a barrier to your physical activity? So yeah, definitely the physical location and the neighborhood environment are crucial in as either barriers or facilitators to healthy eating and physical activity. Um, Trying to think if there was anything else I would like to bring up
just
about.
on,
Yeah.
you think about that for a second, but I'm going back to the idea of the zip code. It's a brilliant idea because it does sort of, looking at a zip code kind of defines a geographic region that you can then examine. And so I'm just thinking for the faculty and student pairs, there's a great place to begin examining various, we'll call it zip code regions, and looking at then the number of green spaces. And you mentioned safety, and I'm thinking here of crime, but also of traffic. Do I have to walk across the street to get to a safe place to walk? All of those variables, I think, could be interesting indicators of how of then relating that to then the health and wellness of that population. They don't have access. If it's not readily available, if it's not safe, I'm going to have less participation.
Yeah. Yeah, and also same thing with food access, right? Is the neighborhood what we call a food desert, meaning you could walk for 20 minutes and you still cannot get to a store that sells any kind of food, let alone healthy food.
Mm.
Or a different concept that we sometimes talk about is what we call a food swamp. So there may be food, but the type of food that you can get in those areas is not necessarily fresh fruits and
I've
vegetables.
not heard that before. A food swamp,
Well,
meaning
there is food, but the food that is available is either highly processed or only fast food or
Sure.
corner stores that will have a very limited selection of the type of items that you can purchase.
I've thought about or have heard about, read about the idea of these Dollar Generals type stores, the kind of the budget, and seeing those develop in very interesting locations within communities. They typically are about a half a mile or a mile outside the city limits, sort of on the borders. And typically there's not a lot of access within the community to, say, fresh food markets. So what do? You drive out, or maybe you walk out to a local store, but what you find there is not fresh produce.
Right.
You might find eggs and milk, but it's going to be mostly processed kinds of foods, right?
Yeah. Yeah. And another factor to consider, especially when we're thinking about communities that may have lower income or lower resources, is that the price of food in those stores are going to be generally higher than what you would see in a grocery store at the inner city grocery store, for example.
Despite their name, right? They're called Dollar General, but it doesn't say how many dollars are general. That's interesting. I never thought about that. Yeah.
We're also thinking about the corner stores and the, gas station stores and
Yeah.
those types of outlets. Yeah.
So if those are environmental, and there probably are other environmental types of indicators that we can kind of be looking at, and for our teams, our student faculty teams to be thinking about. But we've raised a number here, and I'm thinking, of a STEAM related project. So having maybe an English professor working with a faculty member working with a student on interviews of individuals in terms of their, the history of their food, or just gathering data about how they access their food. It could be a really interesting assignment. And then looking at and mapping out food sources. Do you have fresh food markets? Do you have large facilities that contain a variety versus, the dollar stores, or those, you said, sort of the mom and pop local ones? If we can shift a little bit to the individual now. So that's kind of the context that I live in, my family and I live in, and I have to function within that. How does the role of the individual in the decisions I make? I imagine there's a cultural dimension to that, right? What I'm used to, what I see as my comfort food or my go-to food. Are there other factors that impact then my dietary selections? And then the other piece of that, Sonia, I wanted to ask was about the physical activity piece of it.
So, at the individual level, we can think about the classical biology related factors that have to do with, what you eat or your even preferences. There's some biology related to your preferences to a certain extent. Also thinking about medical conditions that may limit what you can or cannot eat, medications that you're taking that may limit. For example, there are some medications that if you take them, you should not be consuming grapefruit, right? So those are going to be to some extent important. But at the individual level, food preferences definitely will make a big difference. And some of it, has to do with what is known to you, what is common to you, and what feels comforting to you from a cultural perspective. It is very, or I wouldn't say very difficult, but for some people who migrate to the US, for example, not finding familiar foods or not knowing how to cook the foods that they can find. And this is not such as an issue here in Arizona because we're so close to Mexico and California, and the types of produce we get here are extremely diverse. But if you go farther north or to the northeast of the US, then you can't find foods that are as familiar to immigrants, for example. So those are factors that definitely will influence what you eat. Your cooking abilities, we know, not all kids learn to cook at home as they used to in the past, just because the lifestyle of the entire family has changed so much. And if mom is not cooking, or if kids are busy with other things, they may not necessarily be in the kitchen learning how to prepare foods. And also, preferences in terms of that are related potentially with religious beliefs, if there is a need to fast for Ramadan, or if for Hispanic communities, Lent is also super, super relevant. So those are going to influence dietary choices. In terms of physical activity, a lot of it as well is preference, and also what you learn growing up will influence, how you perceive that physical activity should or should not be part of your daily life. And some people from Hispanic background, the notion of being physically active feels more as if you had to exercise in a very routine, prescribed way, or if you had to be part of a sport, not necessarily that you could go out for a walk or for a run, or be physically active in other ways. So that may be perceived as something that's imposed and not as something that's part of the culture. And also there's the influence of your family as well. If within your family you grow up with parents who are very physically active, well, that's what you learn. That's part of your upbringing. So it's going to be more second nature to you to do it as well. And it's the same with cooking, right? We inherit our behaviors from our parents as well, not necessarily because we're inheriting them genetically, but because that's what we learn.
Those are the behaviors we observe.
Mm-hmm.
Yeah.
Yeah.
Have you seen changes in both of those two, the physical level of physical activities, and then you mentioned cooking a couple times, which tells me it's kind of important in the growing up process that children are exposed to, and I'm going to suggest maybe healthy cooking, so that when they reach the age of supporting themselves, they've already got that mindset, and they're not so quick to go out and run to the McDonald's for dinner, that they know how to prepare good and healthy foods. Have you seen that change over a period of time?
Yes, and this happens across all cultures. Generally, younger kids are given a diet that is a lot more diverse and a lot more rich in fruit and vegetables and so on. Once they become toddlers, there's a natural development of food aversions, and they don't want to try different things, and they may become a little bit more picky eaters. And then they get to school, and what they are eating is a little bit less out of the parents' hands and more into what's available in the school. And, we have some rules and regulations about what can be offered in schools, but then, there's this tight, there's the challenge of the budgetary,
Sure.
The amount of funds that schools will have to
Limitations, yeah.
provide
Sure.
in school lunches. And then once kids become adolescents, there's a very strong need to be part of a social group, and influence of their peers becomes really strong in what they want to eat. And at the same time, adolescents really want to become more independent. So it's more about, I'm going to do what I feel is important to me, and not necessarily what mom and dad are telling me to do, in a good and in a bad way. I mean,
Sure.
that could mean I've conducted focus groups with middle school adolescents, and they express, I would love to eat healthier, but maybe those options are not available at home, or maybe I did not learn how to prepare those foods, or maybe my school does not offer those choices to me.
Yeah, again, you're kind of raising my awareness here. I never thought about that shift from toddler to school age, and now they're exposed to foods in cafeterias, which I'm going to just say it kindly, they struggle to maintain a healthy diet. Fast food is quicker, cheaper, easier to produce on mass scale, and that becomes then part of what the students are exposed to. In the Hispanic population, what are the specific health threats? What are you mentioned obesity is one. Are there others that you kind of see on the forefront?
So probably obesity is the one that we are most concerned about, and it's not only because it's increasing in prevalence at much faster rates than in other groups, but also because with obesity comes the risk for other diseases, um, such as diabetes, which is also increasing very rapidly in this population. And the scary part is that we're seeing very rapidly increasing rates of diabetes in young Hispanics. So we're talking about kids, we're talking about adolescents
Oh
who
boy.
are developing type 2 diabetes, which we used to call adult onset diabetes, but when they are 10, 12, 14 years old.
Wow.
So that is definitely an alarming case that we're seeing. Something that is not as commonly talked about, but we're also looking at higher rates of fatty liver disease. So that's deposits of fat in your liver that start putting a strain on how your liver functions, and that can also result in different complications long term with the liver, and also affect other metabolic conditions like diabetes. And with greater diabetes, there's greater risk for cardiovascular disease and
Right.
other complications. So it's
Mm,
kind of everything compounded together.
it's a big messy snowball, huh?
Mhm.
There's a lot. So, you mentioned diabetes, the obesity issue, cardiac issues. Are those uh, com completely linked to diet? I mean, are those things, are we seeing juvenile diabetes or adult diabetes in juveniles now as a result of diet strictly? Are there other factors that we're not catching?
It is complex, and definitely diet plays an important role.
Sure.
Um, and so does physical activity, right? We're living in times where being sedentary is more the norm than not. And in cities like ours, where to get from point A to point B, there's no easy access to public transportation, or there is public transportation, but maybe timings of the bus routes don't necessarily align to when and where you have to go to, and distances are long. And then on top of that, with the summer heat, it's not easy to walk to the store, or go to the park and be physically active during the daytime and during the summer. So being sedentary is definitely a factor that contributes quite a bit, and is probably as important or even more so um, than diet, but both are linking to each other. I'm There's a
Wow.
genetic component to it as well. I mean, we know that
Okay.
diabetes runs in families, as it said, and having parents who had diabetes or gestational diabetes for mom during pregnancy increases one's risk to develop diabetes later in life. Um, and there are other factors. Stress, I think, is one of the contributors to all these chronic diseases, because with higher stress, there's more inflammation, and we think that inflammation leads to all this increased risk for many
Mm,
chronic conditions. So it is super, super complex, and there's a lot that we still don't understand. Fascinating also, there's some literature that suggests that the microbes that we have in our gut could play a
right.
role. So the microbiome and how they are processing the foods that we consume. So it's not only how we process those foods, but how are they utilizing the fuel that we're giving them through our own diet? And what are the metabolites that they are then producing that we absorb in the colon that could signal different ways in our metabolism as well. So it is not a simple answer. It's super complex.
Right.
Yeah.
Hey, on the genome. No, I'm sorry. The gut health is the best way I can describe it. Is that genetically connected?
I am not sure if it's so much genetically connected or it's more that the fact that we share the environment with each other that makes, for example, people in the same household to share the microbiome. The gut microbiome starts forming since a baby starts breastfeeding. So the microbiome or the microbes that get to a baby's gut when they are infants is being passed from mom to child. And then if mom and child share a diet, the microbes that are more likely to grow in greater abundance in the gut are going to be comparable because those are the ones that feed and thrive from the same nutrients that mom and child and siblings and parents are consuming. So I think there's that shared and environmental piece that contributes to sharing the microbiome as well.
Do the microbiomes change over time? Do they change with diet?
They definitely change with diet because different strains of microbes do better or worse under different dietary circumstances. Some like, I don't know, sugars more than they like fibers, or types of fibers will affect which microbes are growing in greater abundance in the gut. So yeah, definitely. And with changes of lifestyle, your microbiome can change as well. So if you start consuming more fiber, it will shift towards a healthy, what we consider a healthier microbiome. So yeah, it can change. There are studies that have even shown that when you move in with a different roommate, your microbiome start becoming closer together.
Interesting, really.
Interesting.
Wow. You work in an interesting field. There's a lot there to dig into. I wanted to, because you're painting this picture of both sort of the environmental factors that impact our health, and then these cultural and individual. I'm wondering if you could share with us a little bit about the issue of health inequities. How might our faculty members and their student partners look at an environment and think about, I have a guess what you're going to say, if I can. I think you're going to say you have to focus in, right? To try to wrestle the whole thing is going to be way difficult. But that's what I'm kind of looking for. Where might they look to say, this is different in this location than it is? You mentioned the zip codes. That was really a cool one. Are there others like that might be little mini research projects, sort of?
So when thinking about factors that have nothing to do with your biology that can contribute to inequities, and that those are what we call the social determinants of health. And those will in some way determine where you live and your zip code. But those include things like income, how much money do you have, and that will determine what you can or cannot purchase for food, or even how much time do you have to really cook and spend in the kitchen versus having to work 2 or 3 jobs to be able to procure for your family. The level of education is another social determinant of health, and it's again complex, but the more education, the more likely it is that you'll have a higher income and also greater ability to prepare foods from scratch and know what to select. Health literacy is another one that could be considered. Your employment, level of employment, and the type of employment that you have, whether you are in a more physically demanding job versus something that's more sedentary, so that's going to directly affect physical activity, but also, what are the conditions of your employment that will determine also your dietary patterns or your income level and so on, the type of housing that you have access to, social support. I know this is a little bit harder to measure, but what is your network looking like, and how much can you rely on others to be able to address any issues that may come up? And access to healthy food is one thing that we have mentioned before. Those are the ones that come to mind, thinking about factors that are probably more measurable in a non-biological way, so it's not like
Sure. Sure. Yes, we're trying to stay away from from blood draws and such. Yeah. Yes. But those are great. I'm even thinking as you're talking that through, access to peer groups or social groups, or I don't know, lack of a better term, science groups that you would participate in for a study, or as you mentioned, for that support over time, or healthy eating, or a walking group, for example, that meets every morning and does the walking. However, I'm aware that you're in Arizona, and I understand it gets a little warm there in the summertime. And this has changed. We've all been observing this. I can't see very many positives coming out of that in terms of increasing the physical activity. Would you agree that's going to be what can we do when you're faced with 120 degrees for 100 days on end?
That is definitely something that's extremely concerning here. Climate is definitely making it harder in the summer around here. There are some recommendations like walking indoors or early in the morning physical activity. But long term, I think we'll have to get more creative in how to modify our environment so that those effects of climate change are not as dramatic, I guess. And there are other factors like water access that will definitely impact the types of foods that are available. And this all sounds a little bit I don't know, dire and pessimistic. But I think we can also look at the flip side and think about what we could do that would be beneficial. So if we know that, for example, there could be water shortages and produce access could be affected, well, is there anything that we could do with gardens and using seasonal produce, consuming more what's in season versus things that we have to import from other countries because we cannot produce them here in the summer? That could be potentially a way of looking at, how to address issues that are a result of factors that are beyond what we can control in a more immediate future or individually. Potentially think about other factors that could be driving price of produce that need to be accounted for as well. Yeah.
I would imagine, as you kind of said, some of these observations you're sharing do sound a bit dire. They have immediate impact. They've come upon us not overnight, but in a relatively small window of time. I don't know that we've yet been able to sort of adjust and accommodate. In your field, you're an educator. I mean, I know you're a researcher, but you're an educator as well. What kind of hope do you have for the students that you're now interacting with in terms of their ability to impact the future?
I I'm noticing that the students that we have now are a lot more interested. Well, I wouldn't necessarily say that a lot more, but I'm noticing that there's interest in having an impact, and there's real concern about climate change. I think students are extremely creative, and especially we can think about projects that make students think outside the box. It's not just memorize X, Y, and Z concepts, but how do we use those concepts that we're learning to address real life problems? When there's something tangible that you relate to, I think that's when creativity gets activated. And I think there's a lot of brilliant minds in our student population that can help us go beyond where we are in terms of finding solutions to these issues. Yeah.
But you raised something there which was really interesting. You said it's kind of we have to change our mind as educators and shift away from giving, sort of that content load. You need to know these details, these facts, and memorize these things, to more of that problem solving and creativity part. This project is oriented around the idea of awareness. It's really awareness of health inequities in our communities. And this is kind of the first step, I think, is raising that awareness of designing these assignments that kind of open the eyes of the students and the faculty to these inequities, in the hopes that it stimulates the thinking of, oh, how should I be involved in generating a solution? I think that's an interesting path, and something as educators that we all need to be involved in. So I thank you for that. Lastly, I'm just going to ask you sort of broadly, as you look at your field, and your field's a big one. It's nutrition, it's diet, it's culture. You talked about socioeconomics, psychology. I'm sure all of these things get tied up in that. What advice might you have for the faculty here and these student teams as they begin to think about what their assignment may address? Anything in particular?
So part of it is, especially if you're thinking about health disparities and health inequities, is trying to be mindful that disparities are not a choice, that people, it's sometimes the responsibilities or the blame is put on individuals, but in reality, it's a lot of circumstances and external factors that contribute to these health disparities. So I think being mindful of a lot of the barriers that people are faced with is really important. In my work with a specific population, being very sensitive to cultural values and strengths, and also thinking about those cultural values as assets, not as barriers or detriments to what they're doing. To me, that is very important. So, for example, supporting healthy traits to a traditional cuisine is something that I think is important to do, because that's what will resonate with people more. But also, I think addressing issues that have to do with health disparities from different disciplines combined is interesting. So,
great point. Yeah.
Work, I was trained in nutrition and looking at biochemistry and the lab setting, but there's so much that influences how we eat and how that affects our health that has nothing to do with those molecular reactions, right? So being open to multidisciplinary work and a diversity of ideas, I think is extremely relevant, and even beyond the project that you're working on, really to address some of the hardest challenges that we have.
You talked very early on about your career path there, and at one point you mentioned the fact that you kind of broaden your lens from being in the lab to this. How has that impacted your career? It sounds to me like that would be a sort of an eye-opening experience, and now you've got all of these different inputs you're working with. And speaking of careers, I'm gonna leverage that question to go into a question about what careers you might encourage students to consider in this particular domain. So two questions there. One is how's that interdisciplinary work impacted you? And then what career paths might you see for students in this field?
Yeah. So to answer your first question, thinking more broadly and looking at all the social factors that go into health and diet, has made my career so much richer. And especially when thinking about the humane and the cultural aspects of my work, I just absolutely love viewing, nutrition as something that affects people and individuals. So that is definitely something that I would not change. In terms of careers, I was trained traditionally as somebody with a career in nutrition, but as you can tell by everything we've been talking about, nutrition touches many different fields. You can think about working directly with community members. As a community nutritionist, you can think about more than nitty-gritty details of the biology. If you go into more of a biochemistry side of things, you could go more into health, thinking about dietetics or thinking about medicine. I think nutrition is a fantastic background to have if you're thinking about a medical degree. Community health and public health are extremely relevant as well. So any careers in those areas. Some people don't think about food service management and, more on the restaurant industry, but thinking about, the role of restaurants in providing healthy foods and good options for the public are important. Consulting, communication, I think it's super important nowadays to have people who really understand the science and be able to communicate that in an accurate way to the public. And we need more people being able to translate that information accurately.
Agriculture is another one that comes to mind, right? Agriculture. I mean,
Yes.
I can barely think of a domain that doesn't impact, psychologies, all the ones you've mentioned. There's so many different paths that a student can take that would be tied to or connected to this topic. I have a question here from Janelle. She says, I'm thinking about how community government initiatives influence the culture of healthy living, from HASs to the city government. Different areas of Arizona seem to have different healthy living cultures. Have you observed that?
Yes, and as I was, for example, reflecting on how your zip code impacts your health, we see that, for example, life expectancy, if you compare northern Scottsdale, which is a more affluent area, to South Phoenix, there's a 10-year difference in life expectancy just by that, difference in location. So it's a lot about the environment and policies and access, and unfortunately also about wealth and what is accessible in different neighborhoods. And then in terms of policies, I mean, definitely that influences access to different foods in schools and access to healthcare.
Sounds like it's multidimensional. You have to be sort of attacking this. We have another question here that talks about the how do you promote these healthy lifestyles? So in your intervention work, when you're trying to change some of these behaviors, and the question is, do you go in imposing rules, or how do you make that work?
So I think one of the things that's important is to identify what is already working for people or what they're already doing that's health promoting. So let's say, for example, with more culturally representative cuisine, why do we have to, so there's no need to ask people to consume fruits and vegetables they don't know, they have never tried, and that may not be acceptable to them. But there are so many recipes, for example, within traditional Mexican food that are highly rich in fruits and vegetables that could be promoted as those that are going to be culturally acceptable. And something else that I haven't really talked much about, but I also try to promote, not necessarily focus so much on eating practices, but more, or dietary practices, I should say, but more about what are you doing when you're eating, and what can you do to strengthen your family through your eating. So, for example, if you're having a meal, can you eat with your family? Can you sit down and chat and enjoy a meal together? Can you involve your kids in deciding what's going to be prepared or the menu for the week? So it's there's evidence that shows that having stronger social family ties and more communication has good health effects, a little bit from the social side of things, but also, I mean, it tends to promote healthier eating, eating at a slower pace, and you know, not eating as much, so
Yeah.
smaller portions. So yeah, it's more trying to bring the positives and enrich the family dynamics and the bonding in families that do have a healthy outcome or promote healthy outcomes.
But the very first thing you started off with struck me, and that is know the audience, understand and appreciate and value the culture and the history and the traditions, and engage them sort of in that as a partner in that process.
Yeah, if as a nutrition professional, I um, went to the Mexican community and told them that they cannot eat tortillas, they'll just close the door and walk away from me.
Yeah.
So,
Yeah.
yeah.
Interesting. Sonia, I feel like we can go on for several more days with these questions, but I'm gonna draw it to a close. On behalf of our community, I'd like to thank you for sharing your time and your knowledge and your experience with us. You've given us a lot of context for our faculty and partner teams to consider for these projects, and for that I say thank you. And I'll keep you. I promise to keep you posted in when the assignments become on the other end back in May, or I should say in forward in May. I'll make sure you get access to that list, and I'm guessing we're going to see some in there that have to do with food and wellness. So thank you so much for being with us today.
Thank you for inviting me, and I'm looking forward to reading the compilation of projects.
Thank you. Thanks, Sonia.
Oh, thank you so much for that. That was absolutely fascinating. If our audience or participants, if you continue to have questions around this conversation, please just put them in the chat. Sonia, you are very welcome to stay through the rest of the session, but we're going to transition over to talking a little bit more about the program, and then moving people into breakout rooms so they can talk to each other. So I am going to share this PowerPoint one more time. Let's see if I can make this work. One more time. Okay, and while that is loading up, we talked about the assignment worksheet, and we talked about, where did it go? We talked about the timeline. We talked about evidence-based practice. Okay, so something that has come up in people have emailed and asked questions about is, well, how do we actually do this? What is this really going to look like? So we have the webinar series. You'll all get calendar invites to the webinar series. And the webinars are structured to include 15 to 20 minutes for teams to discuss any webinar content that is relevant to the assignment that they're creating. The webinars are set up in a 90-minute structure so that an hour is dedicated to the speaker, the Q&A, all of that. And then those 30 minutes are any kinds of updates or question answering about the project as a whole and a time for those teams to come together. So as you take a look at the upcoming webinars and the content of those and the speakers for those, we encourage the teams to attend as many as possible, but really to strategize and say, you know, this one coming up is going to be really relevant to what we're doing. Let's everybody in the team attend that one. We are estimating that the teams okay, so that's associated with the webinars. Okay, just think of that as like a different meeting space, right? We are expecting that the teams will meet separately from those webinars, right? I don't know that you'll build that the collaboration that's necessary to build these assignments can only be done in those 15 to 20 minutes that we tack on to the webinars through the semester. We expect that the teams would meet approximately 2 times a month. Okay, so probably more at the beginning as you're doing the brainstorming and you're doing the dialoguing and you're planning and you're throwing ideas around and you're drafting things up and you're really getting a handle on what you're doing. That's probably more frequently than it is at the end where everything's finalized and you're just doing some cleanup and fixing typos and things like that. Okay. We are asking, however, that yes, absolutely. Thank you so much, Dr. Vega Lopez, for your time here today. We very much appreciate your time here. So when those teams meet separately from the webinars, we are asking that you complete, in each of you, faculty and student, completes a 1-question reflection form. Okay. In that form, there are a series of 9, because I couldn't come up with 10, 9, or we couldn't come up with 10, 9 questions that you can choose from. Pick the question that is most relevant to you, that you think you want to reflect about. You don't have to reflect on the same one. You can reflect on different questions. This goes to some of the information that we're collecting through this whole experience, right? Those forms can be found a couple of different ways. You can scan the QR code or go to that bit.ly link to find those reflection forms, or you'll be able to find those forms embedded in the website. They're not there yet, but they will be there shortly, okay? So, and we really, so yes, you could capture that link today, bookmark it, and always have it, but we expect that you'll more likely to go back to that event website to find things as you need them, okay? So those meetings, the assignment document is a Google Doc. We expect that you'll do a lot of that collaboration asynchronously, but you're not going to jump straight into that asynchronous collaboration. You're likely to have some dialogue first. Okay. And then this is just a reminder that we are collecting all of those final assignments. We are requiring that the assignment themselves be openly licensed, and we're going to have a session set up separately for anyone who is unfamiliar with Creative Commons license, open education. What does it mean to attach and for your work to be openly licensed, all the nuances of the different Creative Commons licenses. We recognize that some of you here are very familiar with Creative Commons and so might not need that refresher, and others would benefit from that. So we're setting up a completely separate call that focuses in on Creative Commons. The assignment will be openly licensed, so we can collect them into this anthology. And then we're going to share that anthology back, not just with the grant funder, but also through OER Commons for the OER Arizona hub on OER Commons. So those assignments will be seen by other faculty, higher education faculty, both across Arizona, but could potentially be found by higher education faculty outside of Arizona. So as you're building the assignments, you want the information in the assignment to be as thorough as possible so that somebody else could pick it up and offer it with their students. Okay, so we are, before we jump into the team discussion, I'm gonna share my screen and show you that worksheet. Let's pull that up. We are gonna stop share. Stop share. Yes. No, cancel. Okay. Stop share. Okay, now let's share this screen. Okay, so prior to Dr. Lopez, Dr. Vega Lopez talk about health and nutrition, I mentioned the assignment worksheet and I showed you a screenshot of it, okay? So this is what your assignment worksheets look like. You have down the side here, you have that outline. If the outline isn't open, right, if you don't see it, you're like, what outline? What is she talking about? You click or you scroll over or roll over those three little lines. And if you click that, you'll see the outline. And then each of these are headers that'll allow you to jump around to different sections of the worksheet. Okay. So outline can be very helpful. We're going to start with the top. Okay. I mentioned this is built as a pageless format, and that is set up so that you can adjust these columns, and you adjust the columns by scrolling over it. You see how it gave you that little like arrow on either side. So gosh, maybe I have a really long title and I want more room here on this part of that table. I can scroll over it and I can extend it, right? So you can make more room on the page, on the web page, for you to enter that information, which could be quite useful as you scroll through here. For example, under section 2 for the author information, when you're writing an abstract, you probably want more room there to write that out, okay? And so we did set it up in this pageless format so that you could adjust the size of the table to meet your needs, okay? There are 4 sections here: the introduction, which is really just the title. The author information, both the faculty and the student will be listed as co-authors of the assignment. So please provide that information. So author information. Then section 3 is all about that 3x3 framework. Okay, this is foundational to the assignment that you're building. And so we asked that you identify which of the 3 parts of the 3x3 framework you are embedding into the assignment and provide a reflection of how that's happening. Okay. And then section 4 is the assignment details. So this is where you'll go into that depth, right? About the required materials, about the estimated time to complete, your learning objectives, all those pieces that somebody who's not you would need in order to maybe pick up this assignment and implement it within their space, okay? You'll see as you go through the worksheet that at different places, at the beginning of the prompt is this pretty star, okay? Anything that has that star is what's going to appear in the final, in the anthology collection, right? In the final version of your assignment that is published. So all those reflection pieces, they're not published in the final assignment, right? And you can tell the difference by that star. Okay, all of that is also explained up here at the top of the assignment worksheet. But these worksheets are yours, right? They're for you to edit, add to, customize, make it work for you. Just be aware that when you copy and paste into that final form, each row is set up as a field in that form. So if you're adding additional fields, or if you say, you know, gosh, I really think this makes more sense to move this row down in the document, you can do that, but it will impact the ease of which you create that final form. Okay, so that's the assignment worksheet. What we're going to do now is we're going to move into a team activity, and I'm going to actually do it this way. So,
Debbie,
yeah.
could I just remind folks that on the website, there is a sample assignment that has been filled out. If you wouldn't mind showing that under resources.
This was the other thing I wanted to show all of you.
Okay.
So thank you, Larry. So in the website for the project, so we have a home page, we have the webinar page, and then you have these resources page. If you come down here to the assignment guide, the information that I just shared with you about your worksheet, right? You can find your worksheets right here from this page, right? Under resources, assignment guide. You can also find sample assignments that we've created to give you an idea of how you might you might complete these worksheets. This is also where you will find that form that you complete with the final assignment. Okay, so right here on the website, we are doing everything we can to keep the website a central place for bits and pieces of communication, right? So if you didn't capture that link to the folders, not a problem. You can always come back and find them through the website. If you didn't capture the link to the reflection form, not a problem. You will be able to find it here shortly. Things like that. Larry, was that what you wanted me to show?
Yes, thank you.
Okay.
It's just that there's a little bit of reference material you can look at.
Yes, absolutely. And these are Google Docs that have been embedded into the website. So to open them, you simply scroll over, find the pop-out button in the upper right-hand corner, click that pop-out button, and you'll see that sample assignment. Okay. So now what we'd like to do is move you into breakout rooms. And what we're going to ask that you do is that you navigate to your Teams folder. We'll give you the link to the team folders, or you can scan that QR code and go straight there. The folders are set up so that everybody can edit rather than individually share with each team. So please find yours and work within yours. You're going to locate and open your assignment worksheet. Rename the file to include the student if you know the student, and then start going through that worksheet, right? Read and discuss the instructions, locate and review the section headings that I showed you, but find them in your own space. Make sure you can navigate there. And then if there is time, if you are in a group, if you are in your group, right, start talking about how you're going to work as a group. Identify your meeting cadence. Start thinking about your assignments, things like that. Unfortunately, we do not have everybody, the breakout sessions. Whenever possible, we placed you in your teams, but we don't have complete teams yet for folks. So some of you are in rooms with people from other teams, right? You might be a student whose faculty isn't here today, or you're a faculty whose student isn't here today. That's okay. You can still work together to identify your folders, identify your worksheets, read through those instructions and talk about those. And we're going to give you 15, I'm going to say 12 to 15 minutes in your breakout rooms. And then we're going to pull you all together and answer some big questions. The facilitators are going to jump into the rooms and will also be available to answer questions in those spaces. So I'm going to go ahead and start these breakout sessions. If you don't know where to find your breakout session, take a look in the participant list. And folders.
So the expectation today, Debbie, is not that they're going to completely fill out that assignment form, right? It's
No,
kind of getting them oriented to that
they're just
document and beginning that thought process of what an assignment might look like.
just getting started.
Okay.
Let me grab the bit.ly for that.
Okay, I'm sorry. How do I get into my breakout session? I'm a little
Okay,
confused.
that's okay. Breakout sessions should be popping up in the participant list.
Okay.
So you are, let's see, broadcast event, breakout sessions. So if you look at the participant list on the right-hand side of the screen, at the very top says main meeting and breakout sessions.
I'm not seeing that. I'm sorry.
Just
That's
seeing
it.
chat up there right now.
Yeah.
Okay. In the lower right-hand corner, It has 3 dots, says
Ah,
panels, then a chat, then it says it's got a little person.
Mhm, mhm.
okay.
Go ahead and click that little person and you should see the participant list.
Okay, thank you.
Sure, no, of course, of course.
Debbie, I don't see where I've been assigned. Should I just pick one to go into?
Pick one to go into.
Oh, okay. Okay, I can do that.
Callie and Janelle, same. Just
Okay.
pick one to go into.
Should we avoid going into the same ones? Or
Yeah, I think we only have 5 rooms.
okay.
I'm seeing blue, breakout session 2, green, magenta, purple, and yellow.
Yeah, there's 6 rooms, sorry. There's 6 rooms, so just pick a room, doesn't matter.
All right. I'll take
Oh.
green. That's my favorite color.
Okay,
Okay. I'm
Where are
going
you
to go
going, Larry?
into magenta,
All right. And
I
then
think.
I will jump into blue.
okay.
I have it. All right. Which room shall I jump into next?
Anywhere you want to go.
Let's start at the bottom this time.